The world of medicine is no stranger to controversy. New drugs emerge, promising solutions to complex problems. Ozempic, a drug initially developed for diabetes, quickly gained popularity for its weight loss effects. However, whispers of a dark side soon began to surface. Could Ozempic be linked to an increased risk of suicide? Concerns arose, fueled by anecdotal reports and prompting investigations by regulatory bodies like the European Medicines Agency. These concerns centered on a class of drugs known as GLP-1 receptor agonists, of which Ozempic is a member. While randomized trials, considered the gold standard in research, did not show an increased suicide risk, these trials often lack the scale to capture rare events like suicide. This uncertainty underscored the need for further investigation, particularly using real-world data that reflects a broader patient population. Understanding the potential link between Ozempic and suicide requires delving into the complex interplay between this drug and the human brain. GLP-1 receptor agonists, including Ozempic, exert their effects by acting on receptors found not only in the pancreas, where they regulate blood sugar, but also in the brain. This brain activity raises a crucial question. Could these drugs intended for metabolic control inadvertently influence psychological states? Adding another layer to the concern is the observation that GLP-1 receptor agonists can influence behaviors beyond appetite suppression. Studies have shown their potential in reducing impulsive behaviors like gambling and smoking, even aiding in alcohol reduction. While these effects are generally perceived as positive, they hint at a broader impact on the brain's reward system. The question remains whether this disruption, while beneficial for some, could lead to negative psychological effects, including suicidal thoughts in susceptible individuals. To unravel the potential link between Ozempic and suicide, researchers turned to real-world data. Scandinavian countries, known for their comprehensive and accessible medical databases, offered a valuable resource. A study published in JAMA Internal Medicine focused on data from Sweden and Denmark, providing a large-scale perspective on Ozempic's effects. Researchers identified individuals who started taking semaglutide, the active ingredient in Ozempic, or liraglutide, another GLP-1 receptor agonist, for diabetes between 2013 and 2021. To establish a point of comparison, they also included a control group of individuals with diabetes who started taking SGLT2 inhibitors, another class of diabetes drugs that do not significantly affect weight. This large-scale study, encompassing 124,517 individuals on Ozempic or similar drugs, and 174,036 on SGLT2 inhibitors, provided a robust dataset for investigating the potential link to suicide. A real-world data, while valuable for its scope, presents unique challenges. Individuals taking Ozempic and those taking SGLT2 inhibitors are not identical. They might differ in their age, sex, medical history, and other factors that could influence the risk of suicide. To address this, researchers employed a statistical technique called propensity score matching. This method aimed to create comparable groups by taking into account these pre-existing differences. By ensuring that the groups were balanced for factors like age, sex, and medical history, the researchers could be more confident that any observed differences in suicide rates were truly related to the drugs and not simply due to underlying differences between the groups. This statistical rigor was crucial for drawing meaningful conclusions from the data. Section 5. Unveiling the numbers. After meticulously matching the groups, the researchers analyzed the data for any differences in suicide rates. The results painted a complex picture. Among the individuals taking Ozempic or similar drugs, 77 died by suicide, compared to 71 individuals in the SGLT2 inhibitor group. At first glance, this might suggest a higher risk associated with Ozempic. However, after adjusting for baseline differences using propensity score matching, the picture became less clear. The study found that the risk of suicide for those taking Ozempic was 25% higher than those taking SGLT2 inhibitors. While this finding might seem concerning, it is crucial to consider statistical significance. In this case, the difference was not statistically significant, meaning it could have occurred by chance. Section 6. Interpreting the findings. The lack of statistical significance in the study's findings presents a challenge for interpretation. While the study did not find strong evidence to support a link between Ozempic and an increased risk of suicide, it also did not definitively rule it out. This ambiguity highlights the difficulty of studying complex phenomena like suicide, which can be influenced by a multitude of factors beyond medication use. The study's findings, while not conclusive, provide valuable insight. They suggest that if there is an increased risk of suicide associated with Ozempic, it is likely to be small. However, the wide range of the effect estimate underscores the need for caution in drawing definitive conclusions. More research is needed to fully understand the relationship between Ozempic and suicide risk. Section 7. A conflicting perspective. Adding another layer of complexity to the Ozempic and suicide discussion is a large-scale study published in Nature Medicine. This study, which analyzed data from over 1 million patients, suggested that Ozempic and similar medications might actually lower the risk of death by suicide. This finding, seemingly contradictory to the Scandinavian study, highlights the challenges inherent in studying suicide and the influence of various factors. Differences in study populations, methodologies, and the complexities of human behavior can all contribute to conflicting results. The contrasting findings underscore the need for continued research to fully understand the relationship between GLP-1 receptor agonists like Ozempic and suicide risk. Section 8. The unknown territory of mental health. The ongoing debate surrounding Ozempic and suicide highlights a critical aspect of healthcare: the intricate and often unpredictable relationship between medication and mental health. While Ozempic's primary target is metabolic pathways involved in blood sugar control and weight loss, its effects extend to the brain, a complex organ that governs mood, behavior, and thought processes. This interaction between a drug intended for metabolic effects in the brain underscores the delicate balance within the human body. It serves as a potent reminder that medications, even those meticulously designed for specific purposes, can have unforeseen consequences, particularly when it comes to mental health. Section 9. A call for vigilance. The uncertainty surrounding Ozempic and suicide underscores the importance of vigilance in healthcare. Both healthcare providers and patients must remain alert to any changes in mood or behavior that occur during treatment with GLP-1 receptor agonists. This vigilance is not limited to negative changes. Positive shifts in mood and behavior can also be significant and should be discussed. Regular monitoring and open communication between patients and their healthcare providers are crucial for ensuring the safe and effective use of these medications. Patients should feel empowered to report any unusual thoughts or feelings they experience while taking Ozempic or similar drugs. Section 10. Bridging the gap with open communication. Open and honest communication between patients and healthcare providers is paramount when addressing potential risks associated with medications like Ozempic. Patients should feel comfortable discussing any concerns they have about their medication, including fears related to suicide or other mental health effects. Healthcare providers, in turn, should create a safe and non-judgmental space for these conversations. They should actively inquire about any changes in mood, behavior, or thoughts that patients experience while taking GLP-1 receptor agonists. This open dialogue can facilitate early detection of any potential issues and allow for timely intervention if necessary. Section 11. The future of weight loss and mental well-being. The ongoing investigation into the potential link between Ozempic and suicide serves as a crucial reminder of the complexities of medical treatment, particularly when it comes to balancing physical health with mental well-being. As we delve deeper into the potential of medications like Ozempic for weight loss and metabolic health, it is essential to prioritize a holistic approach to healthcare. This approach involves acknowledging the interconnectedness of physical and mental health, promoting open communication between patients and healthcare providers, and fostering a commitment to ongoing research and vigilance. By embracing these principles, we can strive to harness the benefits of medical advancements while mitigating potential risks and ensuring the well-being of individuals in its entirety.